Hello and welcome back to Living on Purpose. I'm Dr. Allison Brumley, a naturopathic physician, and I'm here with Karen Cox, who's the fabulous health and wellness coach. And today, when I say naturopathic medicine, the majority of people don't really know what that means. And it really could be under the category of alternative medicine or integrative medicine or functional medicine. There are so many terms for different types of care management or care approaches. And so today I just want to make a few clarifications and help you understand really when you're doing more of this herbal medicine and really looking at your nutrition, you are doing more of that integrative, alternative, holistic approach. And so I'm going to have Karen start with really what do you see when you're talking to people, especially for the first time? What do they know? What do they ask?
I think a common question that I always get asked is, how is integrative medicine different than conventional medicine? I believe people, when they come to looking at integrative medicine, are looking for something that's different. They're often frustrated with not getting answers and not being heard and not really having personalized care in conventional medicine. And so, how are you trained to approach a first-time patient when they come to you for seeking answers?
I have about the lengthiest questionnaire that anybody has ever filled out. I want to know how people are feeling from head to toe, and I think that's very different. If you go into your primary care physician, you're just doing your conventional care, you can go in with 1, 2, maybe 3 problems, and that's it. The time built into those is not enough to really create wellness. So I think having more of this functional medical model is extremely helpful because you're putting all the pieces together. I think of integrative medicine really as what I do. Between the naturopathic, in Utah, my scope of practice is pretty large, and it can differ from state to state, actually, what naturopaths can do, what they can recommend, can they diagnose, and all of those things. But really what we're trying to do in this type of integrative care is more of that individualization where say you have irregular cycles. When you do have a cycle, you bleed really heavy. You go into a conventional medical doctor, your gynecologist, and you're going to be put on birth control, either an IUD or birth control every time. They don't measure hormones. They don't look at what's the physiology behind why you're bleeding heavy and your cycles are irregular. So for me, it's having a full understanding of what that is. And I rarely, maybe never, prescribe birth control. I don't necessarily always take women off of it or say, oh, you need to get your IUD out. That's not always the case. But there can be some harm with the birth control. And as they're synthetic hormones, they just shut down your body's production of hormones. And sometimes it can be hard to detoxify from that and really get you back to having a healthy cycle. So that's whether you're looking at you want to improve your fertility, you're ready to get pregnant now. Sometimes it can take 1 month and other times it can take a year based on maybe how long you've been on birth control or how it affects your body. How well do you detox? I mean, all of those things come into play with those birth control strategies. And, not that they're always bad, but you can pretty much guarantee if you go into your gynecologist with any type of menstrual issue, that's what the prescription's going to be. So it's not going to be, oh, let's eat for hormonal health and hormonal balance or take some herbs, or even exercise can have a lot to do with hormonal balance. What are your stress levels? So I'm asking all of these questions of everybody, men and women, head to toe, what's going on, and then putting those pieces together to get the physiology and the biochemistry really working well together so that you feel well.
I like when you said, I'm looking to get people well. You're not looking to just treat the symptoms and what's going on in their body currently, like today. Like, I'm sure you help do some things to relieve things of those symptoms today, but that you're looking to get them well. I know one of the questions I often ask in that interview first intake process is, when did you feel your best? Oftentimes that like triggers something in their brain to go, oh, there was a time I did feel good. And then they can start remembering, and then I often find out what they were doing at that time of their life, lifestyle-wise, that they were feeling their best, and then work to where they are now in taking in that questionnaire. And I know that's what you do. Like, you cast a pretty wide net to get a good picture of the whole body systems and what's going on. So can you talk a little bit about that wide net that you cast?
I will. I find it very helpful to run labs through blood work. It gives me a lot of information, but most of the time I can already say, just from symptoms, if, say, a woman's low in progesterone. If she has spotting before her period, low progesterone. Breast tenderness before your period, it's low progesterone. So there are those signs and symptoms of what's going on even prior to getting the blood work done. So, I've got the lengthy questionnaire with all the things about sleep and stress and cycles, and then running blood work, and then based on what women are experiencing and what we talk about at that first visit, then oftentimes I'll be looking at digestive health, because that can have something to do with it. And I would say in this holistic approach or integrative approach, I will still sometimes use medications, but I oftentimes use them more as a bridge to get you where you want to be. Sometimes I might start with something and then, like whether it's really blood sugar balance. Let's talk about that, because it's such a big issue in that PCOS, which stands for polycystic ovarian syndrome. It's the insulin resistance that drives that whole condition. So that if we do a prescription of metformin for a little while, and maybe that would be the most important in fertility, but ultimately, metformin's a medication. You can have side effects from it, and it would be nice to not have to take that. So then we can do more natural approaches, whether it's really regulate your eating cycle, reduce stress. All of those are going to help balance that insulin resistance so you don't have either high blood sugars or low blood sugars, because you can have both with that insulin resistance. So I think the casting of the wide net, head to toe, do some blood work, maybe some digestive analysis, is one of the most helpful things. But the symptoms will tell you, the picture story of that person is going to tell you the most about how they're feeling.
That's one of the things that I have really liked about integrative medicine, is that you really want to hear the patient's story. And not just what's going on today, but you ask questions from the past, maybe even sometimes going into childhood. I know you often ask, were you breastfed? What would that question tell you?
Well, you could even go back more to, were you born vaginally or C-section?
Okay.
So much of that has to do with the gut health and that microbiome environment of, if you were given that good start of having healthy bacteria that you get both from the vaginal birth and breastfeeding. You get healthy bacteria, and it's your family's bacteria. Like, each family has their own set of bacteria as they're eating the same foods and they're in the same environment. And then the breastfeeding gives people such a good start with all the antibodies and the colostrum. So it really supports the immune system and gives you a stronger start to life than if you don't. But it's not the end of the world if you're not. There are things that you can do, but sometimes you feel like you're catching up.
Right, but it's helping paint that picture for you. So if somebody came in and they were having digestive issues and they were born C-section and were not breastfed, you know that this has been going on in their body for a long time.
Yeah, it's true. The other thing I could talk about, which that you just triggered me to think about, is that one of the other questions is, as a child, were you on a lot of antibiotics? Do you have a lot of ear infections, a lot of strep throat? That will disrupt the microbiome. It causes stress in the body, and it can ultimately disrupt hormones.
And it's just so interesting that when we learn this, we can start to paint a picture for ourselves. I know my own personal experience in working with an integrative practitioner is that all of a sudden I could see, I had surgery at 6 months of age and was put on antibiotics and was not breastfed very long, and I've had digestive issues for a big part of my life. I even had a lot of strep throat and that type of thing going on. So learning that all had a play in how I felt in my journey, and then how to, like you said, it's not the end all. Like, you can rebuild. Your body is amazing. It can heal. It can get all of that benefit back when we know what to do. So the story plays a big part of you as a practitioner being able to treat.
Mm-hmm. Yeah, and even thinking about, when you go to your gynecologist or your primary care, they don't ask about the childhood. It doesn't go into play into what they're going to prescribe anyway. So there's just less of a story that you tell. And one of my favorite things is to talk about nutrition. And I had 15 hours of nutrition in 1 year, versus in medical school, they just really don't get much training on nutrition. And it's true that there are some people who just want a pill. They don't want to change anything. And that's going to be their journey. And then others, who say, I do not want to do a pill. I want to fix this. I want to understand what my body is doing and how I can make it work better. And I think even over the last 10 years, it has grown in importance for people as they think about their health and how they're managing and how their symptoms are. And they're tired of just the, take a medication and you'll be fine, or get more rest and you'll be fine, or lose weight, you'll be fine. It's just not as easy as that.
It's not, and it is interesting because when I was doing my schooling for nursing, those prerequisite classes, the nutrition class was my favorite. But I'm also in there with pre-med students, and they were just trying to get it done and over with because they knew they would never need it again. And right at that time, I was very curious about that. It's like, this is the nourishment for the cell on a cellular level. This should be the most important part of learning medicine.
Mm-hmm. Yeah, the old adage of you are what you eat now has gone even further. You are what you eats.
Right.
So that's where we get our grass-fed meat and our free-range chicken, eggs, and things like that. Is what they eat determines the quality then of what we eat. Mm-hmm. And so I've always really been fascinated with that, and it's the reason I went into naturopathic medicine, is that I knew that there was more to health than just a medication. And I like that approach so much more. Even thinking about the hormonal component of people's health and running labs, it's never to very slim chance that your gynecologist would order that hormone panel. And if they do, they just say, well, it doesn't really matter because your hormones change every day. And that is true. They change every day. But you do get a peak of progesterone and estradiol about a week before you're going to start your period, and which is about a week after ovulation. And that is actually the best time to test estrogen and progesterone. And you can test the pituitary hormones, FSH and LH, at that same time. Or sometimes you can decide to test LH and FSH on day 3 of the period, so right after you start your period. Either of those I have found very helpful for those pituitary hormones. But if you run estradiol and progesterone on day 3, they'll be 0. You're just not making hormones during your period. Mm-hmm. And so knowing that, and even if you can go to your doctor and say, can you please run my estradiol and my progesterone on my day 20? Day 20, day 21 on a 28-day cycle is very good. If you have a shorter cycle, you're going to go in a few days earlier. If you have a longer cycle, a few days later. But always thinking about a week before you start your period is the best time to test those hormones.
And that's so hopeful to know that you can test hormones. And I know that you test a few other hormones. I know that you go into a good thyroid panel and a good, you test cortisol. Mm-hmm. So talk to us a little bit about
this would go back really even a little bit to our episode on the HPA axis. That if your adrenal glands, the cortisol that you produce in there, if they're overworking, you have a lot of stress, the cortisol is high, your body will do something called pregnenolone steal. So we start with this hierarchy of the cholesterol, which is so important to have good cholesterol. You need to have enough of it. And then that goes to the adrenal gland, converts to pregnenolone. And so after that, it will convert to cortisol or progesterone. So we call it pregnenolone steal if you're really stressed and you have to make a lot of cortisol, then you'll steal that pregnenolone and you can't make as much progesterone. So then if you don't make enough progesterone, you have a heavier bleed that next menstrual cycle, because it can be an acute stressor. If it's a chronic stressor, you can just have all the spotting, before your period. And then if your adrenal glands are using all that energy because you're so stressed, then it doesn't regulate your blood sugars as well. And then blood sugars are off. They're either too high or too low. And the other thing is that it can take away from the energy of the thyroid to make good thyroid hormone, which then can take away from the ovaries. So if you're using up all your energy in one organ system, you don't leave enough energy for the others to work well.
So it's just such a neat perspective that you get. So you get the overall health history of a person. Then you get some testing that gives you more of the story and another picture of what's going on. And then maybe let's talk about how you put together a treatment plan for helping a patient achieve wellness in their life.
Well, I will start with lifestyle. I'll start with nutrition, I'll start with exercise, and I'll start with sleep. Those 3 are foundational to healthy hormones. And you cannot take enough herb or enough supplement, vitamin, mineral, to make up for a poor lifestyle. So the lifestyle doesn't have to be perfect, but it needs to be good to create an environment where you can make healthy, balanced hormones. And so if we really go through the lifestyle piece, is that my very first place to start. And this is where I utilize my health coaching, because you can help people really do what they want to do. That sometimes it's just hard to start making those changes and incorporate new things into your daily life. So if we start with lifestyle, great. I really like to get a diagnosis when I start too. So when I look at those hormone pictures, really the LH and the FSH are so important to me. If LH is higher than FSH, that's significant for PCOS. That the LH just has to overproduce because the ovary has such a hard time ovulating. So if I can get a full picture of between the symptom picture, the labs, come up with a diagnosis, we get the lifestyle piece all worked out, what's going to work for you, using herbs, other supplements, sometimes hormone replacement, based on where women are in their cycle and how extreme the symptoms are. And that's where I start.
Which is so helpful, and it's where a lot of people are having success and having results in achieving that wellness. Mm-hmm. So integrative medicine is also integrating lots of things. So I know that acupuncture can be important, massage can be important, other practices and modalities in integrating health. Do you want to talk a little bit about that?
Yeah, there are so many interesting ideas about that. And when you think about some of those ancient traditions and those cultures that have had so much in self-care, Ayurveda is one of those. They have more self-care routines or regimens than really any other practice. Chinese medicine had quite a bit too. They have a self-massage, they have Tai Chi, they've got eating for the seasons, and then Ayurveda goes through the doshas. And as we talk about some of the herbs, many of the herbs I use and I have mentioned throughout these conversations, one is ashwagandha, one is holy basil or tulsi. Those are both Ayurvedic herbs. And these different traditions have had so much to do with self-care. Here in the United States, our history doesn't go back other than to the heritage where we were born, our ancestry. We don't have those same mechanisms for self-care built into our DNA at this point. I think we've lost some of those practices that help us so much
to achieve that health that we're looking for. Mm-hmm. So in your brick and mortar practice, I know that you utilize a lot of these integrative with detox and acupuncture and massage. So how does that work into a patient's care plan?
Yeah, a lot of it can be based on the symptoms they experience and what their preferences are. I think acupuncture is wonderful. It can help so much minimize the stress response in the body. It can help balance hormones. It's interesting now as they actually have a visual imaging of those acupuncture meridians that they didn't used to have, and it maps out perfectly to how it was mapped out 2,000 years ago without all that imaging technology. Mm-hmm. And now we know that as you put the acupuncture needle into a point, it releases stem cells. So if you're releasing and activating those stem cells that make you more youthful, help things work better in your body as you create almost an anti-aging effect with those. So I love acupuncture for that, but not everybody's okay with the needles. If you have a phobia of needles, you're not going to pick that. So that's why it's great that there are so many options for this. In our clinic, we do some IV therapy. And for people who have digestive issues, a lot of other things, infections, they get sick all the time. The infusions can be so extremely helpful, which are really just vitamins, minerals, amino acids. We have some good ones for collagen and, just really helping support the body's nutrients and what they need, especially if you have issues with that digestion and absorption and you just can't get as much as the body really needs of that. And then the number one thing that I think is so important these days is detoxification. So an infrared sauna, even a sauna where you just sweat. The infrared's nice because it penetrates deeper into the body, and so you just get a better detoxification effect. But as we see women come into the clinic, almost everyone's estrogen dominant. It's like, how do we get rid of all this estrogen? And even the xenoestrogens that are more of your toxic estrogens that come from your plastics like BPAs and phthalates. And so if you're detoxing from them, your body will regulate the levels better. So sauna is my favorite. I have hyperbaric. I will utilize that oftentimes. And there are just a lot of really good things. But I think at this point, everyone needs to be thinking about detox.
So true. So true. And we talk about detox a lot on here. So I think that one of the things that we can say that really sums up integrative medicine is that it's really patient-centered. It's a patient-centered approach to helping them achieve their goal of wellness. Mm-hmm. And that as an integrative team, we're here to support them and help them achieve that goal.
Mm-hmm. Yeah, it's just that individuality. It's not like I look at a level of hormone in that blood work and I know exactly how much hormone to prescribe or, how much that's off. I always have to take it with the symptom picture because somebody could have a level of 21 and be symptomatic, and another person could have a level of 21 and not. So it very much is very individual.
Yeah, and I really like that. And I know that our patients really like that mm-hmm. individual approach. So I think in wrapping up this episode, we would just encourage you to, one, know your story, so that you can be your best advocate when you meet with a healthcare provider, that you can give them a big picture of what's going on and maybe look into some integrative medicine and the different modalities that integrate the whole body approach to healthcare that's out there. And I'd like you to like and subscribe and keep living on purpose.